All right. Good afternoon, DeSoto ISD. I am Sonia Cole Hamilton. I serve as Chief of Staff here in our district, and we are coming to you live via our Zoom to talk with medical experts from our community about this current COVID-19 crisis. But first, we will have some quick notes from the district, and we've got some city reps here to check in and share information. We've got the city rep, Kathy Jones. She works in community relations in DeSoto, city of DeSoto. And with the city of Glen Heights, we've got our representative, Mr. Marlon Goff. He's with the EDC in Glen Heights, and they're going to talk to you about how our community is responding to this public health crisis and any resources that may be available to you. And then we're going to speak to medical experts from our community about how we can support and enhance our physical and mental health wellness during this public health crisis. We have been collecting questions to help facilitate our discussion today. So let's go over some quick rules of engagement. Currently, I do believe that I have everyone muted. And that is just so that we can minimize any background noise or distractions. We do have our chat box feature enabled, so please be sure to drop any questions, comments, concerns in the chat box. For those actively present in the Zoom, you may unmute yourself when the time comes, and I also have a co-host who's helping me to unmute people as well. For those interested in sharing notes on social interests, please tag us on Facebook or Twitter and use our hashtag DeSoto ISD Town Hall. As we get started in welcoming our guest today, we are going to kick things off with Ms. Kathy Jones from the city of DeSoto. Kathy, what's going on in DeSoto? What information do our people need to know in order to stay connected and informed about city services?
Thank you, Sonia. We are doing pretty good in DeSoto this week. Our mayor has been tying white ribbons up and down all over town to recognize our heroes. We want to say thank you to our heroes, our first responders, our medical professionals. We're also following along Judge Jenkins' footsteps and encouraging everyone to wear masks when they go out. Got my mask. If I go to City Hall, I got to put it on. We are doing a kind of a little encouraging thing on our Facebook page to send pictures. If you're a superhero, send us a picture of your mask and we'll post it on Facebook. Had some good news from our staff meeting this morning. Our fire chief says that our cases are kind of leveling off. We have no cases in any of our nursing facilities, which is a very encouraging. So we're trucking right along there. Tonight we have a city council meeting. 5:30 will be the work session, 7 o'clock the regular meeting. And during the work session tonight, they're going to be talking about creating a task force to help our small businesses with economic development. And I don't know exactly what the topics are that they'll be discussing, but I think it's generally creating this task force to try to help out. So if that's of an interest to you, dial into our meeting tonight, DeSotoTexas.gov, and search on DeSoto Cable TV, and it'll pop up on your screen. You can watch the meeting going on live. That's about it right now.
Thank you so much, Kathy. As always, we appreciate you joining us. We appreciate the great information you share. Again, if anyone has questions for Kathy, we could drop them in the box. And if we get any, Kathy, we did have our link open to receive questions. I'll check in a second to see if we have anything for you. But I want to transition to our other partner from Glen Heights. Marlon, I see you there. Marlon, what news can you share with us on behalf of your city?
Good afternoon, DeSoto ISD and friends. So we'll start with Best Southwest Class of 2020 Scholarship. The last Friday, the board approved to keep that funding in place, although the banquet's been canceled. City of Glen Heights still looks forward to selecting one student and to recommend for that award of $1,000. So that deadline's been extended to May 8th. I'll post the application link in the chat after my comments. We also have a regularly scheduled city council meeting tonight, 7 p.m. Obviously, that meeting is available via live stream, website, Facebook Live. And then on tomorrow, on Wednesday at 4 p.m., we're going to have a town hall. The focus of that discussion is going to be the 2020 census. It'll start at 4 p.m. So it's scheduled from 4 to 5:30 p.m. Be happy to share that information as well. And then on Friday, again, as part of our weekly series, chats with either the city manager, the mayor, our public safety chiefs. Those are every Friday on Facebook Live at 3 p.m. And then lastly, encouraging any and everyone who's interested in the most up-to-date information to visit our COVID page on glenheightstex.gov. We have a total of 16 confirmed cases, but 11 of those are under monitoring and 5 have recovered. So that's the latest update for the City of Glen Heights. Thanks.
Well, thank you so much, sir. Appreciate it. And then I know that you both are intentional about sharing the best ways that people can be connected. I'm glad to hear that we've got an upcoming city council meeting to keep people engaged. So always, we appreciate your service to our residents and to our families. So thank you so much. Also on the call, though, we have our Superintendent of Schools, and we're going to allow our Superintendent, Dr. DeAndre Weaver, just to bring greetings and give us a few high-level highlights from the district, and then we will jump into our conversations with our mental health experts. Dr. Weaver?
Yeah, thank you, Ms. Cole-Hamilton. I don't want to take up a lot of time. I'm so excited to have these folks on the line today. What's been on my heart and mind lately has just been the mental health, the conditions in which our families and kids are living in right now. It's like 6-7 weeks that people have been restricted from their normal day to day, and that definitely caused a lot of stress and anxiety and all those things that we're not talking enough about and not providing enough options for. Heck, I can tell you right now, being a superintendent and a parent that is trying to help kids learn, there is definitely some angst there, and so we share and understand that and recognize that we offer it to the space. And so I'm thankful to have the folks online today that can help us figure it out, give us some tools, some tactics, some resources that we can kind of regulate during this time of uncertainty. And so just, hey, thank you all for being here. So excited y'all decided to spend your time with us. And I want to kick it back. So let's start it.
Cool. Thank you so much, Dr. Weaver. Appreciate you being here as well. Kathy Marlin, great to have you. You're more than welcome to stay. But if you've got other things to do, we know you both are integral parts in helping to run a city and support a city. So we do thank you for your time here with us this afternoon. As Dr. Weaver shared, though, we've had a strict intentional focus on the mental health and wellness of our students, our families, and also in our staff. And if anybody tuned in to our recent board meeting, we had an opportunity to share some information about perhaps modifying some of our employee days, adding the mental wealth and mental wellness health days to our employees. And that really came as a result of one of our trustees, Dr. Tiffany Clark, was really instrumental in spearheading that. And it really just jump-started a whole conversation that started prior to COVID, but now we really do have an opportunity to really stand on the forefront of doing something really special and great for the people who work to serve our students and families in this community. And so using that as a backdrop for our conversation today, we wanted to be sure that we included some important expert voices at this time. And so we're going to shift gears and prepare to engage with our first guest today. Join me in welcoming Dr. Jelani Ingram, a DeSoto High School class of 2000 graduate and board certified medical doctor, health advocate, and fitness enthusiast whose problem-solving skills, compassion, and integrity have all earned him a reputation as a thought leader. His sights are set on improving healthcare on a global scale by harnessing the power of not only medical treatment, but daily fitness and dietary regimens. He's appeared on Doc Talk 360 Season 1, Dr. Radio, and Fox, and also serves as a consultant for Teledoc and the medical doctor of Bishop Arts Wellness and Recovery Center, Fighting with Your Eyes Closed, a first year's guide to medical school, and Exercise and Muscle Recovery, Tips for a Speedy Recovery After Exercise are two of his publications. Everybody give it up for Dr. Jelani Ingram. Yay! Right? Okay, also though, joining us is Dr. Ahmad Garrett Price. He's a board-certified family physician with Baylor Scott and White Health in Dallas, Texas. Dr. Garrett Price is a graduate of the University of Texas Southwestern Medical School. He currently serves as the lead physician in a new membership-based practice at Baylor Scott and White Health in Dallas, Texas, as well as the Ambulatory Care Governance Committee and the North Texas Virtual Health Committee for Baylor Scott and White. He is a member of the American Academy of Family Physicians and a diplomat of the American Board of Family Medicine. Everybody give it up for Dr. Ahmad Garrett Price. All right.
Also a graduate of DeSoto class of 2000 as well. I don't want
Give
to leave.
it up. We
There you
love
go.
having alumni. Thank you both for joining us. So for this portion of the town hall, we're going to start by understanding some of the common trends in family health as it relates specifically to COVID-19. Dr. Ingram and Garrett Price, what are you seeing with patients during this time?
So right now, let's shortly recap so we can really all be on the same page and understand, what are we seeing, why are we seeing it, and what are we going to see in the future, right? That's what everyone wants to know. And so, we started out by having this virus that is fast moving, stemming from the first known signs in Asia. And we'll understand and we'll know more about the origins later. But right now, I don't think that's as important as trying to figure out what do we do now, what do we do next. And so we're talking about a virus that we first identified last year that's just now starting to really affect economic growth and also educational growth and healthcare growth. And so those three things are something that is holding not only us as a community back, but everywhere around the world. And so you'll hear me talk about the world because it really is global in this sense, and we see that with this virus. But what we see right now with our patients, and me and specifically, I see a lot of fear, anxiety. I see a lot of stress because people just don't know what to expect. Things are changing really, really rapidly in their lives. And so everyone's reaching out for help, right? And so one of the biggest things that I think that, and Dr. Garrett Price will also follow this up with me. One thing we're seeing is the lack of understanding that virtual care is something that's available immediately, right? And so I've been taking virtual healthcare calls, telemedicine calls for the last 7 years, every single day. And I am not kidding, this is not an exaggeration. Every single day, I talk to at least 1 to 2 people, probably 2, that say this is their first time that they've ever done a telemedicine call. So what that's telling me is that most people still, even though there's many, many, many people with the access to telehealth, there's a lot more people that actually have no idea that they can use this service. And unfortunately, some of the people that we're talking about are in very underserved communities, or maybe just an underserved area, or an area that they just don't know, and they don't have access to really knowing how do I actually contact a doctor. Because if you remember, or if you kind of look at the situation, the statistics, many of the community doctors, especially in the Southwest region, are closed. I mean, we're talking about private healthcare companies that are completely closed because some of them have never been able to transition, one, to digital EMRs, digital healthcare records, right? And so we're asking them to transition to a virtual healthcare. That's just something that many doctors never even fathom. And so some of them are just hanging up their hats at this point, unfortunately. And so right now we not only have a access to healthcare problem in a sense that there's not enough docs, but there's not enough doctors that are still active that are actually practicing. And so that's something that we're seeing as well. And I'll let Dr. Garrett Price pick it up from, because he actually sees a lot of family medicine on a general basis. I see a lot of telemedicine on a general basis. So that's why I think it's important to hear from us both.
Yeah, thank you, Dr. Ingram. And just to kind of follow up on what you were saying is that it's important to understand the current context as we move forward to really understanding COVID-19 in its entirety. And agree, this is the first, I'd like everyone to understand that this is the first time we've encountered this particular version of this virus. It first appeared in China in December of 2019. And slowly made its way around the world to be what we call a global pandemic. And yes, there are areas that are certain hotspots, and certainly we've seen the number of cases explode in different parts of the country. Now, in terms of what I'm seeing immediately, locally, and first and foremost, a lot of the talk as of late has been about people kind of returning to the norm, getting back out, etc. I also want to highlight the point, at least, from the front lines and what we're doing in healthcare, is that we still do not have the necessary testing capacity to test actually for the virus, but also test for antibodies. For those who are on the call, antibodies often form when you are exposed to a particular virus. So in order to have antibodies, theoretically, you would have to have had the virus. So we are not able to test for either one of those on a larger scale at this point. We also still have limited capacity for protective, or what we call PPE, right? So that is the equipment used to protect us on the front lines. And so those two fundamental problems that put us in this scenario, we are still having those typical issues. Also, for myself, I'm still seeing rates increase locally. Yes, we've done a fairly good job of starting to flatten our curve, but that is only somewhat delaying what we may eventually see. So despite the efforts, we are still seeing caseloads increase. And as everyone on the call knows, a lot of those caseloads are coming from certain communities and certain zip codes. So that's another observation, is that this is really taking a toll on certain communities, those communities who typically have the diseases that make you a bit more high risk when or if you become infected. Some of those conditions are hypertension, some of those conditions are diabetes, heart disease. Those are things that will put you at risk for getting very, very sick. Now, the issue is obviously more complex than that. When Dr. Ingram says a lack of access to healthcare, you start talking lifestyle, you start talking available food. Those are the things that are really driving this on a local level. So,
and Dr. Garrett Price, I got a question for you. I have a different one for you, Dr. Ingram, so hold tight. Dr. Garrett Price, what can families do to be proactive in their efforts to limit exposure to the virus?
So that's a good question. So first and foremost, we definitely want to practice good, and I know everybody's hearing this, social distancing, but I can't emphasize that enough, especially on the southern side of town where I'm from. My parents still live, and I do regular drive-bys in that area. I don't know if I see that happening enough. And it's really about the collective health of the community, right? Not necessarily yourself, but for everyone in that community. So social distancing is very key. Also, the observing the 6 feet rule, which theoretically should probably be somewhere between 10 to 20 feet, because this virus is airborne. It lives in air, and it can live in air for up to 3 hours. I would highly, highly suggest, knowing that when we say the virus is in air, right, that we basically practice wearing masks at all times in public. I also would say to families, have a hot zone in your home. And what we mean by that, and Dr. Ingram knows what I mean by this, but those of us who have worked in environments where communicable diseases are very prevalent, essentially walking into your home and having a designated area where you will declothe, wash those clothes, proceed exactly or precisely to your shower, kind of decontaminate yourself, if you will, and not bring potential contamination into the home. Good hand hygiene is important. Now, obviously, washing your hands. Another one that I have picked up, knowing that the virus lives in the nasal pharyngeal passageways, would be to do saline nasal rinses, or just shower, steam to kind of rinse out potential, debris or virus particles in your nair. So that's important to do anytime you've been out in public. So those are all some good protective measures that people and families can follow.
Oh no, that's certainly helpful. I have a coworker who I guess loves me very much, because one of the first things she recommended I do was buy this saline, this nasal spray, and I've been using that. I do, yeah, I believe it makes a world of difference. So I appreciate that. And I know our viewers and listeners appreciate that. Dr. Ingram, okay, so we're, many of us are kind of homebound now. Regarding family nutrition and exercise, are there certain tips or advice you might offer to families who want to enhance their usual approach to physical health and wellness during this time?
Yes, and so let me start by saying this. What we're doing currently, as far as every steps we're taking, as far as the social distancing, as far as encouraging people to wash their hands, this is only buying us time. I can't stress this enough, and I want everybody on here to really understand this. The virus is not gone. All right. It doesn't matter when we open. It doesn't matter if we open today. It's not gone. So the thing is, we have to continue to be diligent. It's natural human behavior to let their foot off the pedal, right? And so we're opening back up because we have an economic problem as well. And so we have to merge, we have to be realistic with this and merge the economic problem with the healthcare problem. And we, right now, if we look at the statistics, we haven't tested, but maybe even if I exaggerated, we've tested maybe 6% of the total population in the US, right? So look at those numbers. You go back and you can look at the numbers and you can tell we will have another spike at some point. You know, it may not be the summer, it may be the fall. And so I'm starting by saying, this is an important time right now. If you've been kind of putting off some of the nutrition, the exercise, you've been indulging because you've been at home, hey, totally understandable. There's some depression, anxiety stuff that goes with it, and you can lose that weight, you can change, but this is the time to do it, you know, because we know for a fact that if your immune system is trying to deal with the problems that you're eating, it's not going to have enough fuel to deal with the problems that you're breathing. And so I really want that to hit home, because this is buying us time to become more healthy as a southern region. And I keep saying the southern region because there is difference. You know, I practice in North Dallas. I practice in East. I practice in West Dallas. I practice in South Dallas. So I know the differences. It doesn't matter if you're white, black, Hispanic. It does not matter. Asian, it does not matter, because everyone is entwined with the economic parts of this. And so if one section of our communities gets drugged down, then the other sections also have that same issue with finances. And so if we all collectively support each other and find time to there's a lot of online healthcare programs. So now what I'm talking about is fitness programs, online at home streaming workouts. This would be the time to sign up for those. You know, you can sign, there's plenty. Everyone's familiar with Peloton. They're the most popular. There's some other celebrities that have released them. We even have one called Fit in 15. So there's so many different type of online home workouts you can do. I recommend signing up for one, because most of them are free, if not less than $5 right now. So this would be the time to do it. All right. The second thing is nutrition. I don't know how many people actually follow what I put out on Facebook or on LinkedIn, but I do some of these talks just in general for public health. And so what I noticed when this first started, I went to, and I'll tell you the actual places. I went to a Kroger supermarket in the Wynwood Village area. And then I went to North Dallas and I went to a Whole Foods. It was a stark difference in what foods were being bought, right? So in Westwood, in southern Dallas, most of the vegetables were still there. You know, there's no way that we are going to support our community as even local DeSoto, Duncanville, Cedar Hill farmers if we don't buy local produce. And go figure, that's actually the most important thing that we can actually eat right now to actually improve our immunity, improve our health care, and with water, and also lean protein sources. So that doesn't mean you have to eat a ton of meat. You know, there's other lean protein sources that we have. And so really educating yourself, because we have the time to educate ourselves, and to be able to do that while you're at home and you have extra time, I would recommend having a family meetup where you actually help each other learn those items. You know, so those are the type of steps that I would take right now before we really get back into the flow of things. Because when it opens back up, we've all seen Florida, behavior modification, you cannot change people's behavior. When we open back up, people will go back to the same things. And so you have to try to help protect yourself, your family, and those around you, which includes our communities.
Dr. Ingram, let me just jump in. I want to ask a question, because Dr. Price said something that really, I mean, I knew it, but to hear him say it, it really made me nervous. As superintendent that's responsible for, 8,700 students and their families, he said that this thing is airborne and can live up to 3 hours in the air. That freaks me out. And so I'm thinking about, and thankfully we don't have to do this right now, right? Because we're closed for the rest of this academic year. But, until a vaccine, until, those things are created and distributed widely, at some point there may be some guidance to reopen brick and mortar schools. with the idea that this thing could live in the air for 3 hours, what advice should you give us, as we think about eventually bringing people back together? How do we keep our families and our children safe if we need to reconvene?
Yeah, so I'll start this, and then Dr. Garrett Price can pick it up right after this. But so just to clarify, we use some of these terms so people really can feel to understand fully what we mean. So let's technically break down like the actual word. So the virus is what's called aerosolized, and you're all familiar with it because I'm sure we've all used some type of potpourri spray or something that we've used in our house to get rid of odors, right? So we know from basic physics, don't tune me out when I say that, but basic physics, I'm not going to get in detail. We know that if we spray something that's heavier than air in the air, it has to fall, correct? So what Dr. Garrett Price is referring to is the fact of if someone coughs, sneezes, yells really loud, has an argument even maybe, the actual saliva comes out into the air and it's aerosolized, so it's trapped inside of a particle of water for a certain time period. After that time period, it falls to the ground. That's why there's the suggestions of making sure you're sanitizing surfaces. And also, this is a time to maybe bring out more cultural things that aren't cultural norms in America. Start taking off your shoes when you come home. Don't walk through your house. And that's just, those are standard things you can do.
So Superintendent Weaver, I'll kind of answer your question directly, and then I'll also kind of piggyback on the original question of kind of nutrition and exercise, because I really want to drive that point home as well. Because essentially, we don't have a vaccine, we don't have viable treatment, so your immune system is going to be your first and last line of defense in this particular scenario. But to answer your question directly, I think schools, public health, officials, even more brick and mortar shops will have to really think about, hey, this virus lives in air. It can also live on surfaces, plastic and metal, for up to 3 to 4 days. So strict guidelines in terms of decontamination, sanitation. For you guys, you may step up what you're doing from a quote unquote cleaning perspective, not saying you're not doing enough, but it becomes certainly more of a point of emphasis, I should say. But also, it's realistic to think that we may not go back to a time to where we just do not see people with masks. It may be a norm, a societal norm. If you travel to other parts of the world, even before COVID-19, people who were sick were required to wear masks. So in this particular case, this is something that you have to think long and hard about. Should students wear masks? Should everyone wear a mask when we're quote unquote allowed to return? Should there be gloves? Should there be social distancing? Should we limit the number of children in a particular classroom? Should we limit the number of people in a particular area? So these are all things that you really have to start to put some thought around and come up with some viable solutions, because again, this is a very, very efficient virus. The transmission rate is very high, and the way that it's transmitted, again, it's pretty efficient. So just to answer your question directly, does that give you some food for thought, if you will?
Oh, absolutely. Just thinking about the number of people to be in a classroom, in a building. And that gets me thinking about maybe we have different schedules, maybe we really continue to utilize, this online learning piece and expand on that in a way that allows for both to happen. It is a big concern of mine, though. So definitely thank you for that insight. Ms. Hamilton.
Definitely the virtual online learning won't go away. This is definitely the start of it, and it'll just grow. So definitely us as DeSoto Independent School District needs to push that forward because not only will you have just what we're dealing with right now is parents at home and they're having to deal with kids, but if you jump forward to the future, what you're able to do is really put kids in an environment that they're actually super focused on things that you need them to be focused on, without distractions, right? Without the distractions of being around each other and maybe talking to their buddy right next to them. And so there's different distractions, but there's other technologies that are coming out like virtual reality, augmented reality that are on the cusp that will make that online learning something that absolutely, that if we don't, I would recommend a task force just to tackle the progression of online learning, because it's that critical to getting our children back to even past where they were before, because we've had such a deficit on this what you said, 6-week pause, right?
Yeah, I would agree on that. We've seen industries change right in front of our very eyes in healthcare. I mean, Dr. Ingram and I have been doing telehealth for, better part of a decade. So what I'm saying is the echo to your industry is that the industries are changing in front of our very eyes. So we have to be, this is a time to be, yes, it's a quote unquote crisis, and there are people out there who are suffering more than others. We also need to look at this as a good time to innovate and really look at our processes and things that we can do differently. And before I guess pass it back, just to, again, those nutritional tips. The reason I want to go back to this very quickly is that, again, I also take care of a certain subset of patients. Obviously have a large patient panel consisting of African Americans and Latino patients. And part of the reason, I know we have all ethnicities represented on this call, but certainly your interpersonal health, as we call it, is of the utmost importance. Again, this is a virus that we cannot treat and that we cannot vaccinate against. So your immune system has to be very, very competent. In our practice, we have a saying that food is medicine, exercise is therapy. And we mean that in the truest sense of the word. A lot of these heart conditions, diabetes, hypertension are all acquired based off the way that you live your life. That's why they're called acquired illnesses. So at minimum, some very bullet points to stick to: 150 minutes of exercise a week. Now that can be jump roping in your garage, push-ups in your bedroom. I like to frame it in that manner and not look at days per week, because that is an obtainable number. Medical literature has showed us that those who can raise their heart rate for just 150 minutes a week will dramatically lower their chances of acquiring heart disease, i.e. having heart disease, stroke, etc. Also, what we don't talk about enough with exercise, and some of our mental health experts will certainly speak towards this, is that exercise in and of itself is a very therapeutic activity. All of my patients who have anxiety, who have depression, who suffer from other chronic mental health comorbidities, if you will, exercise is the very first thing I recommend, because that naturally starts to release a lot of the positive neurotransmitters, endorphins, that these medications are trying to unlock. So that's an important part. 7 hours of sleep, limiting smoking and drinking. Sleep is the time that our body really repairs itself. So when you start talking about supporting your immune system, you have to give it time to really reboot, if you will. Anti-inflammatory diet, or putting good foods in your body, green leafy vegetables, carrots, sweet potatoes, non-processed foods, limiting salt. Echo Dr. Ingram, we've challenged our patients to do meatless Mondays. We know that those compounds, meat has a lot of inflammatory properties to it. And also, just from a strictly preventative perspective, now is not the time to lapse on your medications or the compliance or taking your medications, especially if you have these conditions that make you high risk: hypertension, diabetes, asthma, chronic obstructive pulmonary disease, also known as COPD. Make sure you are virtually checking in with your physician and having enough of a supply of medications, 90-day refills, and you need to have periodic visits every 6 to 8 weeks. That's just a number I'm throwing out, but frequent visits to really have them check your health status, because again, your health will ultimately depend on how healthy you are if you do become infected with this virus. So just wanted to drive that point home.
Now that's great. I hope y'all are writing down this free medical advice they're spitting for us today. This is great. Okay, gentlemen, we did receive a call. We had an early question submission bank. We received a question. I want to pose it for you all, and then we're going to transition to our wellness experts as well. The question is really regarding gloves. We recognize that the mouth covering, the masks are, a recommended requirement, but the question says, can you ask medical doctors about the risks of wearing gloves? What about cross-contamination? A lot of people don't understand this. What can you tell us about whether or not we should be wearing gloves at this time?
All right, so yeah, I'll start, and then Dr. Garrett Price will pick up. I'll keep it short and sweet on my side, and then he can get in a little bit more detail. So for people that I recommend to wear gloves, Healthcare professionals may wear gloves, they may choose to, but if you have a lesion, a sore, abrasion, any type of problem with your hands, you may choose to wear gloves. So you actually, if you have some type of opening in your hand, that means that you don't have the full protection of your skin. And so another layer may help you have that protection. Now, if you don't have any sores or lesions on your hand, doing proper hand safety and hygiene will really wash off any virus. We know that the virus sits on dirt that sits on your skin. All right. So don't think that this is something that you can't get off of your body. It actually, the virus sits on dirt and it's very sticky. And so if you wash your hands with soap, not necessarily antibacterial soap, but just soap, the soapy suds basically surround that whole capsule of the virus, because the virus doesn't like water. It actually likes fat. And so once you use water and soap, the virus actually falls off because it falls off in the dirt. And so just basically, if you have something on your hands that maybe is an infection or opening, you can wear gloves. But if not, I wouldn't stress yourself out trying to find gloves. I would just wash your hands, do hand sanitizer, and be very diligent about when you touch things.
Yeah, I would echo Dr. Ingram. I think I personally wear gloves if I'm out, but then again, I'm a trained medical professional, and Dr. Ingram knows this, but we kind of go through a training specifically on how to remove gloves, right, that have been contaminated. So for the average individual out there, if you do choose to wear gloves, you do have to understand the potential risk of cross-contamination. And generally, you will want several pairs of gloves, and that's how we do it in the medical profession. If you are going into the store and you put gloves on, okay, great, but you should probably be removing those upon leaving the store. And there's a certain way that you can deglove and take off your gloves. So instead of kind of being inundated with that level of protective acumen, what I would just say is that wash your hands frequently. Keep hand sanitizer with you when you're in public places. And if you do choose to wear gloves, you should be changing those frequently. From environment to environment, you should be changing gloves. And when you take off the gloves, you should be washing your hands still, and you should still be using the hand sanitizer. So if you're going to take the gloved approach, just understand you are going to need multiple pairs of gloves with you. I hope that's helpful.
I think that is helpful for members of our community. I know that as people have rushed to buy masks, they've also been looking for gloves as well. And so I think you were able to provide some clarity. Gentlemen, we thank you so much, and we appreciate you taking time to speak with us today. The second half of our town hall is going to focus on managing and enhancing the quality of our mental health during this time. Join me in welcoming two very well-respected experts in mental and behavioral health. We've got Dr. Brenda Richardson-Rowe, who is a mental emotional health and wellness expert who serves as the Director of Counseling of the Harmony Counseling Center, where her primary mission is to heal those who are hurt, wrap around those who are wounded, and free those who are bound. She's a native of Dallas, Texas. Richardson-Rowe is a graduate of Emerson University and Cornerstone University Calvary Seminary. Dr. Richardson is commissioned as a minister of counseling and is licensed as a clinical pastoral counselor and clinical Christian counselor. Give it up for Dr. Brenda Richardson-Rowe. Okay, also joining us for this portion of our dialogue today is Dr. Mona Robbins. She's a mental and emotional health and wellness expert who graduated from Howard University before going on to continue her studies at the University of Illinois at Urbana-Champaign. Dr. Robbins currently serves as an assistant professor and licensed psychologist at the UT Southwestern Medical Center, where she provides psychological services to adult patients with cancer. Using a developmental lens, she provides care to children, adolescents, and adults to understand the disease progression and its coping with it. Her interventions focus on psychosocial, biological, and cultural dynamics that promote and hinder mental health wellness. She is the founder and president of the DFW Association of Black Psychologists, and she served as the executive committee of the Dallas Psychological Association. Ladies, we thank you for joining us for this very important discussion on mental and emotional health during this time that is undoubtedly stressful for many people and many families. So let's start by understanding some of the common responses to stress that people may have in response to this crisis. Dr. Richardson-Rowe, we will start with you.
All righty. When we talk about stress, it's very individual. So everyone responds very different to stressors. Some of the common things that we see are changing in eating habits, changing in sleeping habits. A lot of what I'm dealing with my practice and with my staff really mimics the grief process. So many times when we talk about grief, we think about the death of the loved one is what we think about. But grief is about loss. So there's so much loss occurring during this time. Loss of being close to friends, loss of going to familiar places, loss of income, loss of jobs, that there's a lot of grief symptoms that have to do with being in denial. Is this really real? And we heard a lot of that early on. Is this a hoax? But it's really real. A lot of anger, a lot of bargaining, some depression, and then to some degree accepting where we are and being at a place to be able to identify what can we do in the midst of this pandemic.
Dr. Robbins?
Well, I would say first is that what was just spoken is that everyone responds differently to a crisis. And that even means that your response may not even look like the response of the people who you live with in your same house. You know, some of us actually throw ourselves towards or into things to help us to cope, and others of us just avoid or we pull back or shut down, while many of us may fall somewhere in the middle. Then it's about normalizing the situation. And honestly, first of all, there ain't, and I say ain't nothing normal about what any of us are experiencing right now. So if you notice how you're feeling, you're likely having a normal reaction to an abnormal situation. And with that comes a need for adjustments, which may include giving yourself permission to not be okay. Too often, especially in homes where there's limited support or resources, there's this need to be everything for yourself and everybody else. Now, while there's nothing necessarily wrong with that, you have to be mindful of when your cup is depleted or when it runs over with so many responsibilities that you can't hold on to what sustains you or grounds you. And in times of crisis, we get thrown all around. It's hard to access that part of our mind where we're creative to identify strategies that can help us to cope and develop. And so finding a way to center yourself, and us talking about some of this today, may be helpful.
Absolutely.
Yes, Dr. Robbins, thank you for giving us permission to feel what we feel during this time. I know when you watch social media, we see so many people just crafting out the wazoo and just doing it all. And thank you for giving us permission just to feel what we feel. So then my question for both you ladies is, what are some ways that people can proactively monitor and then manage their stress and anxiety in response to everything that's going on?
I'd like to say, first of all, start with knowing your norm. And so much of what we're going through, and again, I'll use ain't. It ain't normal. None of it's normal. And what we're looking at, it's not going to be normal for a while. So really know that you're responding in a very abnormal, sustained setting. Many times helping people to think back at a different time to things that may have brought them comfort, things that they may have enjoyed. You may notice my backdrop. I'm an ocean barefoot girl, and I can't go to the ocean right now. That's where I would have fled to had I been able to. So I had to bring it to me. So helping people to think about what are some of those things that even maybe you wish you had an opportunity to do. Take the opportunity to do that now. Is it gardening? Is it being out in the yard? Is it connecting with your children more and being able to think of games to play? Really thinking more on what you can do that can bring some calmness and some joy doing this eventful pandemic time, as opposed to being focused. So many people are still so glued to TVs and glued to social media. And those are two things that are really causing a great increase in stressors amongst people, because it's really like looking at some of the same things occurring over and over and over again. And so I would really recommend people connecting to those things that bring you some joy, or trying even some new things. Give yourself permission to try some new things. So think about doing some coloring with your kids or different games with your kids. When we were talking earlier from a medical perspective about nutrition, that's a wonderful thing to do in your home, is to start cooking. And I can raise my hand to that because I'm a 3 meal a day out eater. Okay, at least I was a 3 meal a day out eater. But learning to cook, learning, even if you have children, to engage your children in that process of cooking and doing some things that are really productive can decrease your anxiety and decrease stressors.
And I would say that, I mean, there's many different things that people will pull towards them to help with anxiety. And I'll even share, if you're feeling stressed or you just feel like something just ain't quite right, because for whatever reason, we have a hard time putting our finger on or naming anxiety for what it is, because it manifests or looks a little different in different people. Some of us, we feel it, we feel uneasy, we feel afraid, nervous. Others, we feel it physiologically. So that lump in your throat, you're wondering, oh, what's going on with me? Stomach butterflies, your body's aching. We also have it behaviorally. We avoid, oh, I can't deal with that, I'm not turning on the news. Or cognitively. Now, this is the part for my high-level thinkers, folks who tend to go all in their head. Mm-hmm. You're worrying. Rumination is thinking about thinking, and we're constantly in our minds having a hard time falling asleep or waking up. So just in the interest of time, I'll share 3 main points. One thing I talk to my patients about is organizing how you're dealing with things, especially if you're feeling overwhelmed, into my 3-bucket approach. So ask yourself the question, can it wait? And so bucket 1 we have, is this about my livelihood? Does this have to be addressed right now? Is this about my well-being, my family, obtaining resources, food, toilet paper? Do I need to address that at this moment? Maybe so. Second bucket, can it wait? There's a likelihood that it could. Perhaps this is something I need to address, but I'm going to set aside some time, maybe a day. I'll do that when I get off my Zoom at 4 o'clock, or maybe I'll do that with my kids on Wednesday. Likelihood. And bucket 3 is, can it wait? Probably could. And I'm be honest, there are a lot of things that can wait. And this is really teaching us about that there's a lot of things that we may not necessarily need. Can all of y'all understand that there's a lot of perspective taking that's happening here? And be honest, there are some things that can drop and be just fine over there. Many of us pride ourselves on being multitaskers, but in a time of crisis, that skill set may not be the forefront of what you need to do. You might go back and pick it up later, but honestly, it can go away for a little while. So you think about, can it wait? Number 2 is, if you feel like you just have no sense of control, I would say it's important to establish boundaries and routines for yourself. If you're working from home, where are you centralizing yourself? Where can you sit where you may be away from a little bit of the commotion in the house if you live with others? And are you waking up at the same time every day, trying to go to bed around the same time? And the other piece is about what you got going on. Now, I know those pajama pan parties on Zoom might be the thing right now, but it's another reason why some places in schools, kids have uniforms, because how we look affects how we feel, affects how we interact and present ourselves. So ladies, sometimes, and guys, if you need to put them brows on and just get right, just to help yourself feel better, it's important because it does affect your affect. And for that, you have to think about, too, reassessing your current abilities. There's some things we could do, but can you really do it right now? And I'm not saying that you're incompetent or unable to complete the task, but you really have to give some idea about what you're able to do so that you don't set yourself up for unrealistic expectations, which leads me to the idea of establishing reasonable goals. Who else out there feels like they're not as productive as they used to be? Well, I gotta set goals for myself, maybe on a weekly basis, so I can remember what day of the week it is, or even on a daily basis. Those 7 things that I could do so well in one day, maybe I'm gonna do 3. Today, I have patients. Before this, I had patients. After this, I have patients, teleconferencing. And I'm gonna see my patients, I'm gonna do my notes, and I'm gonna go watch a movie, and that's it for the day, okay? And my last piece, Dr. Richardson Rose spoke about so beautifully, is if you're having a hard time coping, really pull out those reserves. We all have strengths there somewhere. We've had hardships that we've gone through before that we from and think about, how can I take that and just reallocate it to this situation? If you rely upon prayer, journaling, exercise, and talking with your friends, if you need to do a little hangout, video conference, do that. But seek out resources for help, whether that means connecting with others or seeking professional or spiritual counseling. And I'll end with this part. Pride has no place in times of pain. So it's important that you are honest about what you're feeling and get the support for what you need.
You know what, and that's a perfect segue into my question. I like how you were sharing that stress looks different for everyone. We handle it differently. So at what point does one's mental and emotional response to crisis escalate to a level of requiring additional help? What are some things we should be looking for to know when it's time for us to reach out?
Exactly. First of all, know your norm, and don't ignore when you feel and imagine that you're doing things that are not part of your norm. And when things, your emotions, when your fears, when your anxieties start to impact your daily routine for more than a couple of days, you need to start to be concerned about where you are from a mental and emotional place. Unfortunately, too many times we continue down that path to a place that becomes then critical when we could have actually responded at a much earlier place. I'd like to just put a plug in and just add, in terms of seeking help, there is nothing right. It takes strength to identify your weaknesses, and it takes even more strength to choose to seek help for it. There's help all around you. There are people all around you. There are physicians, there's counselors, there's pastors all around you. Please reach out and seek help. Even if you don't think that you need it right now, someone else's objective opinion may be able to help you make that decision, and may even be able to walk with you and support you in making that decision.
Definitely. And the other piece is that we all have various degrees in which we experience emotions. We may all become sad or angry, mad, irritated, annoyed, etc. And so sometimes people don't want to use the word as depressed mood or anxiety because they think that puts them in an automatic category of having a mental disorder of sorts. And there are psychiatric diagnoses, but those are different. And so if you're noticing that your mood, for example, is so down and you're unable to really be yourself or to find any interest in things and joy. I mean, not just the bored, I have nothing to do around the house, but just really having that lack of desire of life. And that's happening for days upon weeks, and you're noticing that you can't change. That's when it becomes a problem. So it's really about that level of distress to where you can't snap back over to where you were before. When the anxiety is becoming an issue to where it's creating conflicts with others, where you can't sleep, where you're constantly thinking about your thoughts and you can't produce at all in any form, that's when you may want additional support so that you can figure out, well, how do I work through this? So there are times when we have our concerns that we can manage ourselves, and other times it becomes a little bit more and we need the support of someone else, maybe a friend or family member. And then even still, it can escalate beyond that to where our loved ones love on us so hard that they can't often see some of our blind spots, and we need professionals. And that's where I would say to seek out help from someone else to help you work through what I call our stuff.
No, that's definitely helpful. And I know that earlier, Dr. Robbins, you said you may have some information to share with our viewers. So I have allowed you access to do that whenever you're ready for that. But we did have one more question for you all. And this just is regarding just the historical limited access to mental health resources for communities and people of color. What are the impacts, whether they're actual or perceived, of the barriers to mental and emotional health access, and what low or no cost resources available to people of color could help? How could that help our community?
I'll speak to that. There's so many different impacts. First of all, there is a realness in terms of what's available, what's accessible, and especially in communities of people of color. On the other side of that, there are also things that are available, services that are available that aren't being accessed by people of color. So it comes to a constant education, a constant connecting, a constant decreasing fears, and making it aware of what is available. So many times, one of the things I do a lot of work with pastors in the area, and especially for people of color, that is where a lot of information comes from. And I have seen a huge difference as pastors talk about getting help, talk to their congregation, and also have resources that they can use to help their congregation, and giving people actual permission to seek that help. And it's not, do you pray or do you go to see someone for some help, but you can have Jesus and a therapist too. You can have them both. You need them both.
That's right. Need them both. Work and pray, both. But I'll say this is that what I see is that barriers to mental and emotional health care access have cumulative effects that create a culture for how we handle, again, our stuff. And you can take we as you see fit. It can be we as a race or group of people, we as a community, or we as a people with or without resources. So when there's a lack of access to mental and emotional health care, it conveys a message that these types of resources are not important. They're not important to be provided to communities that need them, and not important to be pursued. So I realized that, it's not enough to just say, go out and seek professional help, especially when, number one, you don't know where to go find it. Two, you're having a hard time accessing the type of care, either financially or for location reasons. Or let's be honest, three, you don't trust the care that's given to you. So when providing and asking for resources, we have to be careful about the narrative that follows and realize that we could all benefit from mental and emotional support, right? Honestly. But it has to be provided in a manner that meets the social, economic, and geographic needs of a community. Otherwise, it is not patient-centered, and the disconnect with community may be more a reflection of a flawed attempt or process. So I really share these points because sometimes we hear, communities of color, they won't utilize these types of resources. But then the question becomes, were the resources designed, developed, and designated to be used by these communities in the first place? If not, then a fair chance was not had. So in thinking about how to access resources, I'd say for those that have insurance, it's helpful to contact your insurance carriers to obtain information for mental health providers within your network and by location. Sometimes you can do this on the back of your insurance card by calling in and getting information. But for many people who may be uninsured, underinsured, or looking for sliding scale fees, etc., I'm looking on my screen now. I'm going to share with you a list of resources as opposed to me listing them out verbally. And perhaps I can give this to you, Sonia, and maybe you can post this somewhere for others to see later. Okay, so let's try this piece. Okay, can you see this here? And again, I don't expect you to be able to read. Yeah, I don't expect you to read it all right here, but what I did was I went through some of my resources that I create, and I also vetted and called to ensure that some were still providing resources or what was going on given COVID-19. So you'll see the agency phone number, their website, and some of the areas. I tried to find things that were close to this area, DeSoto, Dallas, and you'll see this, that most of these here are on an outpatient basis where they're doing individual appointments with either adults, children, or families. And then at the bottom, you can hear that Chicago fast talk. At the bottom, you see this inpatient or intensive outpatient program. So in this case, when we talked about elevated care, this is elevated, meaning that someone may need to be hospitalized because they have suicidal ideation, or they're like unsafe to themselves, or maybe they have an addiction problem and need to be in a facility where others can care for them. And so we have Dallas Behavioral Healthcare Hospital in DeSoto, as well as Parkland Hospital. And then on the second sheet, I have crisis resources. So National Suicide Prevention Lifeline, as well as a crisis text line. But the other thing that we're seeing right now with families being at home and we're spending a lot of close time together, we're seeing an increase in reports of child abuse and neglect, as well as domestic violence and sexual assault, unfortunately. So I included some lines here, as well as some mental health support lines. So if you're just calling because you're trying to get a sense of how am I doing, like what am I experiencing, and just need some reassurance, that's something that's provided, as well as a veterans crisis hotline as well.
And before we, I know this audience is going to be primarily adults here, but we're not 100% sure how many of our students may be watching. But what are some things that you all would say to students, and in particular during this time?
what I'm seeing, because we serve students and children from the age of 4 through 18 here at the Harmony Counseling Center, what I'm seeing a lot of is just not understanding what's going on, and a lot of fear, and helping parents to understand, especially younger children. They tend to respond in the way that the parents or the home environment is responding to what's going on. Some of the things that we talked about in terms of bringing some order, I describe what parents have gone through is that they've had everything about their life, including starting their own ISD, dumped on their sofa at home, and trying to manipulate through all of that nuance has caused so much stress. But helping parents to bring about order, to bring about what time of day they're going to do things, what's best for the family, what time's going to be school time, what time's going to be playtime, what time's going to be family time, has been some of the things that have really, really helped families to start to bring about some calmness, even in the midst of all of the crisis that's going on. Knowing your kid, because many times if there's uproar in the family or discomfort in the family, older kids, and when I say older, 9, 10, they don't feel comfortable talking about how they feel, because they'll sometimes take on being responsible for what's going on in the home. So I really, really encourage people, educators, all, we look at it from a total family systems approach. So not just the kid, but the kids surrounding, the kids' parents. And what can we do? And most providers now, even who were not doing telemedicine, are pretty much predominantly telemedicine. So their services available right now. And many of them, and I'll just put a plug in for one of the services, we're getting funding from outside sources to cover the cost of counseling. So my goal is getting the people in to get the counseling for free. So we are getting all kinds of influx of funding to help support what's going on, so people without insurance don't have that burden of costs in terms of the services.
Mm-hmm. That's so great, Dr. Richardson. We've got members of our SEL team, our social emotional learning team on the call as well. Definitely want to make sure they get connected with you so they can share some of those resources with our families. And Dr. Robbins, that list you shared, definitely please make sure you get my email address. We would love to add that to our website as a page for resources. So we appreciate that. Ladies, any final parting thoughts before we transition?
I think the thought I'd like to leave for all of us is just to remember to, first of all, have hope for yourself, and then helping other people who may appear more fearful, more hopeless, sharing that hope with them. That it's not like the end of the world today, but we don't know when this is going to end, but focusing more on what we can do and a hope in a future.
And I would just say this is a time of great discernment right now, regardless of where you see yourself from whatever position of either spiritual, religious, or just believing in being. This is a time to be very reflective about how your relationships have impacted you in ways in which you can continue to grow with them. I think that we have all been forced to be in a place of stillness right now that many of us may or may not appreciate. But I think with that comes a lot of chances for us to really consider what type of lifestyle we want to live. We heard from our medical experts about ways in which we can take advantage of trying to get ourselves healthy physically, emotionally, and spiritually. And we all do need each other. When I think about the kiddos, and what I would say to the children is that your parents need you right now. You're right. Unfortunately, some kids are having to grow up a little faster, but now's the time to explore some of these emotions that we're all feeling, even if it's just a little irritability, and to be honest with that space. But we are people, and this is what we feel. So it's a time for us to feel it, to be honest, and to grow together.
Most certainly, most certainly. And ladies, I want to thank you both for joining us today. We've gotten comments in the chat box. I got people side text me. They are loving the conversation that we've been able to have. Very authentic and just much needed. Dr. Weaver, we did have a question earlier in the chat box, and I don't want Ms. Pearson to think that I overlooked it, but it is certainly something that we are talking about. And her question was just really centered on what does it look like when we do resume, back in our physical buildings, in terms of if it's feasible to have staff and students have their temperatures taken before entering the facility to help eliminate those who are sick from making someone else sick, similar to what's been done in some airports overseas. She just wants to know if we've been discussing that or if that's a concern.
I think there's going to be, and to the point of our earlier doctors, there are going to be so many more guidelines and regulations around how people can commune when they come together. And so I'm not ruling out anything right now. Again, this virus is something that has not necessarily been contained at this point. And so we are going to implore whatever regulations, guidelines, advice, wisdom that we can, so we can keep children, and by way of those children, our parents and community safe. So we're not ruling out anything. Are we having conversations about the future? Oh, absolutely. I mean, we spent, the first several weeks trying to stand up a structure for learning to happen during this time. But now we're shifting to think about, well, what happens from the day school is officially over all the way until, December 2020, and heck, through this time next year and then 21. We have to do some things differently. There has to be some different structures. We are going to have to continue to leverage this new kind of online virtual structure that we have built, because from some of the reports that I've read and what the doctors mentioned earlier is that there could be, and very likely will be, another spike. And so what happens if that spike is so significant that requires us to do more sheltering in place? We just don't know. There's so many things we have to consider in the future. So we're thinking about that plus.
Yeah, definitely. Thank you, Dr. Weaver, for sharing that. And as we prepare to close out, just a few parting notes. If your question was not addressed today, please feel free to send your questions to info@desotoisd.org for a response. And please note that our next town hall will take place Tuesday, April 28th, where we're going to hear from students and how they are responding to adjusting to life during this COVID-19 pandemic. As always, lots of great things happening all over DeSoto ISD. I'd like to remind those watching to be encouraged, keep the faith, and take care of yourselves and each other. Together we will. Bye. Thanks for joining us.